Welcome to Good Enough with the Trauma Therapist, a podcast dedicated to empowering you to take control of your life, learning valuable strategies for healing and looking at mental health through a trauma-informed lens. Get ready to feel empowered and confident in managing your symptoms. And now, here is your host, licensed clinical social worker, EMDR therapist, and certified clinical trauma professional, Jamie Vollmoeller.
Welcome to Good Enough. I am your host, Jamie Vollmoeller. And today we are doing a deep dive into Project 2025. As a woman, as a mental health advocate, as a women's advocate, as a domestic violence advocate, as for all of the things I believe in, I think it is so important for the public to know what is in this document. And for those of you saying that this document isn't what Trump is going to do, I also just want to note that in this episode, we will be going over the very real bills that are in our Congress that are also mentioned in Project 2025, passing and putting through. So whether or not any candidate in particular says they endorsed Project 2025, I will note there are multiple Republican bills that further restrict women's access to reproductive health care in Congress currently. So this is something that we need to discuss no matter what side of the aisle you are on, because if you are for women's reproductive rights, then we should be reaching out to our Congress and making sure that this legislation certainly does not get passed. Because I believe in sharing the facts. For those of you listening via podcast or radio, if you want to fact check all of this, I will be share screening the actual Project 2025 document in this episode on YouTube, and going through specifically the page numbers, what is that, and then what each of these facts say and what they mean, because it is that important for us to all understand. And not everyone has the time to do this extensive research, so thanks to maternity leave and having a newborn, I have plenty of time to scroll and look up all this information for you guys. And I really do think it's important to do so, because this is so critical to women's reproductive health care and women's rights in general. And especially having a baby girl that I just brought into the world, there is nothing more important I think I could do as her mother than try to ensure that she has at least the same rights that I had when I was brought into this. So let's get into it, guys. I am going to just share my screen real quick. So we're going to start with 317. All right, because I want to just start with a broad overview, and I think it's really important to just start there. So page 317, it says, HHS also pushes abortion as a form of health care, and health care is in quotes, skirting and sometimes blatantly defying the Hyde Amendment in the process. Saravino writes that FDA should reverse its approval of chemical abortion drugs because the politicized approval process was illegal from the start. When they're talking about this, guys, they are talking about mifepristone. So mifepristone is an abortion drug that will end your pregnancy. It is also one of the safest ways to end a pregnancy, and is really used within the beginning state, like the first 3 months of pregnancy. Very, very important for women who are also miscarrying, which is the most common time for us to miscarry, which is in that first 3 months, to ensure that all of the fetal tissue and everything is removed from the body, and that the woman does not need further surgery to acquire a DNC. And I say this as a woman who, during my second C-section with my son, I did have to go back in a week later because part of the placenta was left in me, which could have made me gone septic and was rotting literally inside of my body. So I had to go through a second surgery to remove what was left over from delivering my child. So even when we miscarry, we do need health care and medicine to ensure that we don't require further care or we don't have further complications. And that is really, really important for everyone to understand. Back to the document, page 317, continues. Saravino writes, the HHS should pursue a robust agenda to protect the fundamental right to life, protect conscious rights, and uphold bodily integrity rooted in biological realities, not ideology. So what they're talking about here is an embryonic personhood. So for those of you who don't understand what embryonic personhood is, this is how IVF got launched into this whole crazy debate. So embryonic personhood means that from what these policies are arguing is that life begins at literally conception. So in vitro fertilization, which is what IVF stands for, you take the egg and you take the sperm and you put them in a petri dish. And as soon as the egg enters the sperm, now that is a person. That is embryonic personhood. That embryo and sperm cell that have just conjoined now have rights. That's a human being with life, according to these types of policies. And that's how they want this defined in the law, that a cell essentially has personhood, and that personhood is more valued than the fully functioning, adult woman or child or female. I should just say female, because this does happen to children. Children get pregnant, guys. That is also important for us to remember. The female who is carrying that embryonic cell that might not implant to the uterus. There are multiple ways in which that might not become an actual human and person. They could not implant right. There could be DNA abnormalities, which make our body reject those cells to begin with. There are multiple things that could prevent that from actually going on to full term beyond what the woman actually desires, right? They think that petri dish has more right and to becoming alive than that woman who's carrying that has to preserving her own life and her own health and what's best for the future of herself and her existing children and family. That's also important. Also, it says the next secretary should also reverse the Biden administration's focus on the LGBTQ equity, subsidizing single motherhood, disincentivizing work, and penalizing marriage. Replace such policies with those encouraging marriage, work, motherhood, fatherhood, and nuclear families. So basically, anything that is supporting families outside of what Christians feel should designate a family, as in a mother and a father and a stable relationship in the same household, does not count as a family. So, I don't know about all those women that are widowed, or husbands who are widowed, or people that it just doesn't work out and they get a divorce, or the person leaves, or there's so many reasons, or in non-traditional families, like same-sex parents. And there are many different types of families. And I think it's kind of crazy that in this document, they're literally pushing for legislation that would only support families that meet their ideal of what a family should look like. And if you are not part of that group and you do not ascribe to that ideal, then the government, I guess, should not have to take care of you because you're not conforming to what they believe you should. And again, guys, this is America. This is not the kind of rhetoric we should be expecting in our own country. So I'm going to go to another page. We are on now page 471 of Project 2025. It starts with a prohibiting federal funds to assist in women traveling to receive health care. I understand that people are automatically going to be like, well, my taxpayer shouldn't pay for them to go receive health care. Yeah, your taxpayer dollars are going to nonprofits that are helping women to flee states where their rights have been violated to the point that they cannot access health care, and their danger of losing their ability to even bear children for many of them as a result of delays in care, which make them infertile, or they are dying. When our government messes up so bad that women lose their basic right to healthcare and being treated before they're bleeding out on the table and on the verge of death, it is the responsibility of our government to make sure that those women are not dying in the states where this is consequences. So anyway, they would reverse Biden's executive order that is currently funding nonprofits and efforts to get these women the care that they need in other states where abortion is still legal. That obviously has some profound consequences on the women already who are struggling with accessing reproductive health care. They also want to withdraw the Medicaid guidance of Section 111.5 waivers issued thereunder, and withdraw and disavow the interpretation of the Hyde Amendment. So the Hyde Amendment basically, they tried to argue that the Hyde Amendment prevented federal funds from being used to transport these women because it would not cover abortion. There's nothing in that document that explicitly says that. They're just trying to broaden it so that they can further restrict women's in the state's ability to access care, which is really, really sad. They also plan to prohibit Planned Parenthood from receiving Medicaid funds. And this is where it gets really, really insidious. So most Planned Parenthoods, first off, like, they don't just fund abortion. I want to make that clear off the jump. They are also just funding general women's health issues. And there are such vast health deserts for women receiving reproductive care in low-income communities already, that basically this just further makes it so those women will not have access to care. And it gets worse. So it says policymakers should end taxpayer funding of Planned Parenthood and all other abortion providers. So anyone who even provides reproductive health care as a service. Now, again, when they say abortion, they're talking about embryonic personhood here. So they're also talking about like access to contraceptives, access to any kind of healthcare that would interfere with a woman's ability to maintain a pregnancy, or to get pregnant. They are literally trying to control women's bodies by telling us that we can't regulate our own bodies with our healthcare providers in ways that are healthy for us. That is insane. The bulk of federal funding for Planned Parenthood comes through the Medicaid program. So they're basically now trying to restrict access to have Medicaid fund any sort of reproductive health care, because all of these clinics that serve these lower income areas would essentially be shut down due to lack of funding. Okay, so HHS should take 2 actions to limit this funding. Issue guidance reemphasizing that states are free to defund Planned Parenthood in their state Medicaid plans. So that's giving those red states the ability to basically say, we're not going to provide reproductive health care to anyone that's receiving state insurance. And I want to remind everyone that through Obamacare, those state-sponsored plans are Medicaid plans. They are Medicaid plans. So even if you are paying for your insurance through the state marketplace, if Medicaid was not allowed to cover these, those plans that you are paying for are part of the Medicaid system. So your plans that you are paying your hard-earned money for, and many small businesses ascribe to these plans for their employees as well, because they're one of the only affordable or semi-affordable plan out there to us. All of those people now do not have access to reproductive health care. That's major. Congress should pass the Protecting Life and Taxpayers Act, which would accomplish the goal of defunding abortion providers such as Planned Parenthood. So again, this is an actual bill that is in Congress. It's called Protecting Life and Taxpayers Act, which would defund anyone who provided access to an abortion. Okay, that's major. So any women's health organization is going to provide access to contraception and methylprostate and all of these abortion drugs, because it is part of reproductive health care. It is part of managing women who are miscarrying. That's just a crazy, unrealistic expectation that I understand the ideology behind it, but the reality of what it takes for healthcare providers to adequately address women's reproductive health emergencies requires for these drugs to be available. Okay. CMS should also resolve pending Section 1115 waiver from Idaho, South Carolina, and Tennessee, which, like Texas in January 2022, are both seeking to prohibit abortion providers from participating in state-run Medicaid programs and to work with other states to do the same. Abortion is not healthcare, and states should not be free to devise and implement programs that prioritize qualified providers that are not entangled with the abortion industry. So again, this is furthering the spread of lack of access to reproductive health care. I'm going to name those states again that haven't yet done it, but want to. Idaho, South Carolina, Tennessee. If you're from there, please listen up. Contact your providers. Honestly, all of us should be contacting our legislators because, again, this is way more insidious. It gets worse. So here, and I literally wrote out here, New Yorkers, listen up. They can do it here and they have done it before. I want to remind everyone that's in a blue state that feels like, oh, because my state would protect my right, I don't have to worry. So this does not have to be taken into account because it doesn't affect me. It does. It does. And for a man who penalized New York during COVID because we did not vote for him and he did not agree with what our leaders in positions of power were doing, he did not send us ventilators. He delayed the sending of masks. He delayed the sending of funding. He contributed to the immense loss of life that we experienced here in New York because he did not feel that, New York was a place that he had to worry about because we're not Trump country. And that's, first off, he's not going to support us if he feels that we don't have 100% loyalty to him because that's his playbook. And they are trying to make it so that in our states, they would basically make it so we don't get funding. So they're going to try to strangle the state budget and not give us any funding for what we feel that should be provided, because that would essentially force the state into adopting their policies, whether or not our people agree with it. So I'm going to read this. Withdraw Medicaid funds for states that require abortion insurance. So in New York State, right, if we go back to what they plan on doing in reinstating Trump's executive order that made it so that employers do not have to cover abortion and their healthcare plans, right? If New York was like, nope, all New York employers still need to cover this, which of course New York would, they're not going to give us any federal funding for Medicaid. Do you guys know what a disaster that is for our state budget, for us, our finances, for making sure that New York doesn't fall into like this crazy hole? It's insane. Withdraw Medicaid funds for states that require abortion insurance or that discriminate in violation of the Weldon Amendment. The Weldon Amendment declares that no HHS funding may go to a state or local government that discriminates against pro-life health entities or insurers. In blatant violation of this law, 7 states require abortion coverage in private health insurance plans, and HHS continues to fund those states. So again, we're talking about like those deep blue states that are like, this doesn't apply to me. Yeah, they're coming for us. They're coming for New York. They're coming for California. They're coming for us, guys. They don't want us to have our states protect the rights that, we believe that we should have. HHS under President Trump disallowed $200 million in Medicaid funding from California because the state's flout of the law, but the Biden administration restored it. Trump tried to not pay the $200 million. I believe, if I'm not mistaken, California did eventually get paid. But yes, he tried to withhold $200 million from the state of California, and he did for a period of time, because he didn't like that they allow abortion care. Like, it's insane. Oh, actually, I think specifically for California, it's because they don't have any reporting requirement for abortions or miscarriages in their state. So because of that, Trump was like, we're just gonna not give you Medicaid funds then because the law says we can do so. And I want people to really think about that. Just because the law says that we could do something, our law is supposed to change over time. And unfortunately, our Congress has been so messed up. There's been very little legislating, which is the creation of new laws that adopt to the general consensus of the time, because most of Americans agree that women should have reproductive rights. This shouldn't be a discussion. This is a conversation between her and her healthcare provider, and it's none of your business. But our laws don't necessarily reflect that. And instead of making laws that do reflect the general consensus of the American people, we have politicians who are trying to take laws literally from, I think like the Comstock Act was like the 1870s, and like use those laws to basically say this is law so we can restrict your rights. Like whether or not there's something on the books that hasn't been used that way in decades, right? Or over a century for some of them, doesn't mean that that's the right thing to do. And I think we all agree to that. That's manipulating the system. That is not the way that our Constitution was supposed to be written, and our Congress has not functioned the way our Congress is supposed to function in quite a while. And these are the real live consequences of those situations. As we continue, they also want to make separate payments for any abortions. So again, they are trying to just further track who's paying for what and who's getting abortions. And they don't want any elective abortions covered. But, according to these people, everything is an elective abortion. Yeah. So the Hyde Amendment compliance, HHS should undertake a full audit to determine compliance or non-compliance with the Hyde Amendment and similar funding restrictions in HHS programs. This audit should include a review of the Biden administration's post-Dobbs executive actions to promote abortion. Or, I wouldn't say promote abortion, but it's really important the language that's being used here. Post-Dobbs executive actions were to try to protect women's rights to reproductive health care and make sure that women could access the health care that they needed to take care of themselves and their families. It should also encompass a review of Medicaid managed care plans in pro-abortion states. So again, in the states that are pro-abortion, because that's what they keep saying, right? It's based on the state. The states that are not agreeing with their ideology, they're trying to make it very, very difficult for these states to not comply because they're trying to restrict funding. They're trying to use the money that we as taxpayers pay. And as a New Yorker, we pay way more in taxes than we get back from the federal government. As a Long Islander, we pay way more in taxes than we get back from the state. But anywho, the fact that, my tax dollars are going to be basically withheld because we don't believe in their ideology, like that should be concerning to people. That is the plan. The plan is to try to make it more difficult for us to fund the things that we believe in our states. This next one is also really, really rough. We're still only on page 473 of Project 2025. First, distorted pro-abortion interpretations added to the Emergency Medical Treatment and Active Labor Act. So this is an actual act in Congress. The Emergency Medical Treatment and Active Labor Act prohibits hospitals that receive Medicare funds from dumping emergency patients who cannot pay by sending them to other hospitals. So basically, if you receive any government-funded health, or if you accept any government-funded health insurance like Medicare, Medicaid, CHIP. CHIP is the Child Health Insurance Program. So I know many families whose kids are insured by CHIP insurance, and this will affect your teenage daughters. So listen up. In July 2022, HHS CMS released guidelines mandating that the Emergency Medical Treatment and Active Labor Act covered hospitals and the physicians who work there must perform abortions to include completing chemical abortions. The guidance also declared that they would protect physicians and hospitals that perform abortions in violation of state law if they deem those abortions necessary to stabilize the woman's health. Okay, so this is what states like Texas keep saying is like, oh, well, it's on the doctors. We're not saying if it's in cases where a woman's health is at risk, like this is just because the doctors aren't listening to what the law says. No, very clearly right here, they're saying that this act protects physicians and hospitals that perform abortions that they deem necessary to stabilize the woman's health. And they want to undo that. They want to undo that. I think that is very crucial for us to understand. What people say and what their actions are often very, very different. And what I've learned from being a therapist, from being a trauma survivor that's really good at reading people, honestly, is that you learn a lot more about what people's intentions are from what they do than from what they say. People can tell you anything, but it clearly lines out black and white right here that, their intention is to decrease access to abortion. They know that's unpopular, so they're going to tell you something different. But behind your back, that is what their policies currently in Congress are trying to do. Undermine your civil right to reproductive health care. Okay. Oh, yeah. They should also rescind the guidance and end CMS and state agency investigations into cases of alleged refusals to perform abortions. So on top of going after, like making it easier for them to go after doctors and hospitals who are providing reproductive health care, on top of that, for those that don't, that refuse to provide health care, even though it's affecting the mother's life, even though that the mother could die based on their religious beliefs, like you're a doctor, you took a friggin' oath to not do harm, and your religious beliefs should not come above the oath to your fellow humanity. Otherwise, you probably should not be operating as a doctor that is in that capacity, at least at a minimum, because it's a danger to every woman that walks into your emergency room. But anyway, so if they did this, they would be like no repercussions for doctors and hospitals and healthcare organizations that just said, yeah, no, we're anti-abortion, so you can now bleed out and die, and that's God's will. And there can be no consequences, criminal, civil, otherwise, for these people. Like, that's insane. That's insane. It's just crazy. Okay. Still only on page 474 here. Enforce, oh my God. So this is in this document, they go into these crazy conspiracy theories about how babies are being born alive and left to die. You can't see one case of this. There's literally not one case of a baby being born and then like being executed afterwards. Like in any case, honestly, even when people have to get these elective procedures, like often I was listening to a woman who was talking about when she was carrying her twins. They might have had this rare disease where basically only one of the twins would survive. And they wanted to push back that operation as long as possible because there was a chance that, they would be able to save one of the twins, but the other one would die, or both the twins would die if nothing was done. So again, no one wants this to happen. This woman had the horrible choice of, I let both of my children die, or do I try to save one? And they wanted to wait as long as possible in her pregnancy so that if that child was born and like that if that child couldn't be left in the womb to continue to grow and they had to take him out, they would have the best chance of survival when they get out of the womb. Like that is every doctor's primary concern. No one is, whether the woman wants it or not, no one's cutting out a baby and saying, yeah, I'm gonna, like, that's illegal. That's already, like, that is a human life. If they're breathing when they are born, then they have a birth certificate. Like, that's murder. So these are crazy conspiracy theories that are literally now acts in Congress. So again, another lovely act discussed on page 474 is the Born Alive Abortion Survivors Protection Act, because that's really needed, guys, because there's not one case of any babies being born alive and then killed. But Born Alive Survivors Protection Act is also covered here. Permanently codify both the Hyde family of amendments and the protections provided by the Weldon Amendment. Congress can accomplish this through legislation such as the No Taxpayer Funding for Abortion and Abortion Insurance Full Disclosure Act and the Conscience Protection Act. So these are 3 acts that would permanently make it so that you could not get your abortion access through government funded programs. And, again, people want to say government funded and you're talking about like, I shouldn't be paying for someone else who's, sleeping around and they're just getting these left and right. Like that is not what's happening. We're talking about, again, government funded programs include Child Health Insurance Program, CHIP, which many teenage girls are on. That would mean that those teenage girls cannot get access to birth control. Whether or not you agree that teens should be having sex, they do. And if you don't want them to have to get abortions, very good idea to put your kids who are having sex on birth control. Our children would not have access to reproductive health care on chip. Like that's not acceptable. Not acceptable. These state-sponsored plans through Medicaid, through Obamacare, like the New York State of Health Marketplace, anything you bought on there, any insurance that you bought through the state at all would not cover reproductive health care. Like that is major. We're not talking about, like I feel like this is often framed as, well, yeah, as a taxpayer, I shouldn't be covering this. Like, no, we're talking about like we all benefit from government funded health insurance like the CHIP program or Obamacare, whether it was popular or not, or whether it's rolled out perfectly is definitely up for debate. But there are millions of Americans who have benefited positively and are doing better because they have access to healthcare and can now actually get treatment. And that is major. And that does help us as a society. Good. All right. This is where I said this one I had to go through all of the pages because it just really gets worse, guys. So they want to radically redefine sex. So on August 4th, 2022, HHS published a proposed rule entitled Non-Discrimination in Health Programs and Activity. This rule addresses non-discrimination provisions of the Affordable Care Act, known as Section 1557, which is enforced by the Office for Civil Rights and the Center for Medicare and Medicaid Services. Section 1557 prohibits discrimination on the basis of race, color, national origin, age, disability, and sex in covered health programs or activities. Under the proposed rule, sex is redefined. Discrimination on the basis of sex includes, but is not limited to, discrimination on the basis of sex stereotypes, sex characteristics, including intersex traits, pregnancy, or other related conditions, sexual orientation, and gender identity. I think that most Americans agree that we wouldn't want to be discriminated against for any of those things, right? Like, it's not okay for people to be discriminated against that. That should be a right that is protected. I think most Americans agree to that, right? Back to the article. The department proposes to interpret Section 1557 as if it created special privileges for new classes of people. I don't think there were new classes of people. Pregnant women have always existed. Intersex people have always existed. There's always been gay people. Like they're people that existed. You might not want to acknowledge them, but they exist. They've always existed. Jeez Louise. Defined in ways that are highly ideological and unscientific. I think this entire document is highly ideological and unscientific. It's a bit the pot calling the kettle black here. Yeah. The redefinition of sex to cover gender identity and sexual orientation and pregnancy to cover abortion should be reversed in all HHS and CMS programs. I'm going to repeat. They said the redefinition of sex to cover gender identity and sexual orientation and pregnancy. At least so we cannot be discriminated against because we are pregnant. Should be reversed in all HHS and CMS programs as was done under the Trump administration. This includes the Child Health Insurance Program, CHIP. Low-income families who rely on CHIP should not be coerced, pressured, or otherwise encouraged to embrace this ideology motivated sexualization of their children. Like, I don't think no one's encouraged by this, but like there's the reality of the fact that there are a lot more latchkey kids now. Parents are not able to be at home and be with their kids all the time and monitor all of their behavior. And there is an increase of promiscuity amongst teenagers, and kids are having sex, and pretending like it doesn't exist or providing them education and care so that they can prevent pregnancy, which would disproportionately affect their life and the outcomes of the success of them and the success of the children that they are pregnant with, are ideological and unscientific. The words that they are using is what describes this policy. It does not make sense to not provide teenagers adequate health care or education or anything other than abstinence. Like, it doesn't work. Research has shown us this a million times. Just because you don't agree with it doesn't mean that science is wrong. You can't just say science is wrong because you don't like the facts. Those are the facts. Science isn't wrong. All right. Sorry. I'm very frustrated by all of this. And I'm about to get probably even a bit more frustrated because I'm going to get into IVF. And for those of you who don't know, both of my first two children were conceived through IVF. I would probably not be a mother if it was not for access to IVF, and not that that access was even super accessible. I had to save and, be very conscious about my employment decisions to ensure that I had access to IVF so that I could become a mother. And what's really strange to me about this whole proposal is, getting rid of IVF has nothing to do with, it doesn't make sense. If you're worried about families and you want people to have more children, like, why would you be making it any more difficult for us to have access to IVF? But again, it's because that's not the agenda. The agenda is not to make the family stronger. The agenda is to take us back to a time where men were in control and, women did not have quite as much voice or power as we do now. And if you listen to the way that some of these people speak, it is very clear that they do not believe that women should be in positions of power. And if that's how they feel, that's fine. But I am not, as a woman, going to sit down and take that without any sort of fight. So on to the page that gets into how this will affect our access to IVF. So if we continue down, I think this is still under the HSS, but we're now on page 450. No, this might be I think it's a different section, but either way, we are on page 460 of Project 2025 mandate, where it says bioethics reform. It's the last paragraph at the bottom. Research using fetal tissue obtained from elective abortions is immoral and obsolete. Research using human embryonic stem cells also involves the destruction of human life, again, because they believe in embryonic personhood, and should not be subsidized with taxpayer dollars. Good science and life-affirming ethics research are not mutually exclusive. In fact, ethically derived sources such as discarded surgical tissue and adult stem cells, not tissue obtained from elective abortions, have contributed to the most successful treatments of various ailments. Yeah, so have, a lot more has come out of fetal tissue research, but okay. Congress authorized HHS to choose not to fund extramural abortion-derived fetal tissue research that fails ethics board's review. I would agree with that. I mean, I think there's a board of ethics for a reason. I don't think that, we should be promoting that idea, but that also doesn't mean we shouldn't be researching at all, which is what they're eventually going to propose. So we will get there. Trump's administration, HHS, chose that course. Subsequently, however, the Biden administration restored unrestricted funding of abortion-derived fetal tissue research. HHS should promptly restore the Ethics Advisory Committee to oversee abortion-derived fetal tissue research, and Congress should prohibit such research altogether. And that's really what it comes down to, right? It's not elective abortion. Like, they don't think that fetal tissue should be in research at all, again, because they believe in embryonic personhood. So I don't think that that's the stance that most people have on research or when life begins. It goes on to say, end intramural research projects using tissue from aborted children with the NIH, which should end its human embryonic stem cell registry. So again, any sort of embryonic stem cells or any sort of stem cell research, entirely against. Aggressively implement a plan to pursue and fund ethical alternative methods of research in order to ensure that abortion and embryonic destructive related research cell lines and other testing methods become both fully obsolete and ethically unthinkable. So again, because this is against their ideology and their morality, because they believe in embryonic personhood, they want to do away with embryonic stem cell research altogether. And this, again, does contribute to IVF. So I go on. Because the male-female dyad is essential to human nature, and because every child has a right to a mother and father, three-parent embryo creation and human cloning research should be banned. Okay, so what this is saying is that IVF is against nature. So they don't want to allow IVF at all because IVF would allow a single mother to become a parent, right? They can use donated sperm, allow that single mother to become a parent, and that child would be raised by that single mother. That is perfectly fine. That's a perfectly acceptable human family, an American family, but they do not want that to occur. IVF also allows for same-sex couples to have their own children. They're right here saying that they do not believe in that. IVF allows for people that are in, homosexual married relationships to take sperm from a sperm donor or eggs from egg donors because maybe one of those parents had cancer previously. Like, let's say the wife had cancer and she can't use her eggs. She has an egg donated, and that would not be allowed because that would be a 3-parent embryo creation and human cloning research, which they think should be banned. So at the end of the day, they believe that IVF as a whole should be banned because it allows for creations of family systems that they find immorally wrong. So therefore, IVF as a whole, not an option.
So as someone who had to use IVF to create my own family, I was told at 18 we'd have issues having kids. Me and my husband literally made a lot of our choices in colleges about what our careers would be based on what would allow us to have kids early. Because we could not wait till we were in our 30s to have kids. We knew that I would not be able to probably do that. Although I did just have a kid now, but that's not the information we had at the time. So IVF is very, very near and dear to my heart. And it really breaks my heart that so many women might not have access to this, that I have family members, I have friends that have used IVF to create their families. And it's really a beautiful, beautiful process. And I don't understand why anyone thinks that they have the right to determine whether or not you should be able to create a family, especially a party that's preaching, family values and wanting families and all this nonsense and calling out childless cat ladies, but then making it impossible for us to have children. It's kind of an oxymoron. But yeah, it's really, really major. Part of the reason that IVF is not able to be done anymore in some of these states by doctors, or they don't feel comfortable doing it anymore, is because defining an embryo as a person has consequences, right? So if they're saying that this cell in a petri dish is a human being and has the rights of a human being, and that ending that life would be murder, which is what they're saying it is, that means that doctors, all the embryos don't make it. As someone who went through IVF, I think I got 20 eggs that came out. I think only 9 fertilized, and then maybe 5 made it past day 5. And I'm very lucky for those numbers. Some people are lucky to get 1. And it's not even a really quality embryo. So we're talking about very, very fragile embryos here that can definitely not take. So even the creation of these embryos and them not making it, that could be considered murder, right? And transporting them against state lines, if they're moving them, if the temperature gets off and the embryos don't make it, again, murder. Doctors and the clinics can go to jail. That, first off, that's insane. It's just insane. But it's not murder. There's a reason that an embryo has never been considered a person, because it's not a person. And science says that. This isn't ideology, guys. This is science. This is facts. This is, if we're going to, it's also just mind boggling to me, right? So if all are they going to start arresting men for ejaculating, guys? Because those sperm, they could be creating humans and they're not. And because they ran up in that sock, that could have been a person and they just ruined that person's life. It's insane. It's insane. And the fact that, they want to consider, embryos to be people. Embryonic personhood is a serious threat to women, because an embryo is not a person. It's a fact. Pregnancy, a fetus is considered a parasite. That's literally what it's considered in the medical world. And that's not because we don't value human life. It's because there's, again, with science and nature, there's no guarantees that that's going to become a human being. And up until a certain point, it can just significantly impact a woman's health. If you have an ectopic pregnancy, that's a pregnancy, guys, but you wouldn't be able to get healthcare with that pregnancy. You would not be able to end that pregnancy unless it becomes dire. So an ectopic pregnancy is stuck in your fallopian tube. So when the fetus continues to grow, it can rupture your fallopian tube and you can bleed out. And actually that did happen last month to a woman. She bled out because she had an ectopic pregnancy and they needed to wait to give her medical care because she wasn't in danger enough at the time. And that's terrifying. That's terrifying. I have family members who've had ectopic pregnancies, and these are like very religious people who very much wanted children and were trying for a very long time and had to go and receive services to end that pregnancy because an ectopic pregnancy is not viable for that fetus. And it will also kill you as a woman. It will kill you. So when we're talking about these things, they are not hypotheticals. This is literally what is happening in the real world with the current laws that are currently in place because of our lack of protections. And I think it's really, really important for everyone to understand, to take notice, and to stand up because it's not going to end there. Right. And I think that we hear this a lot. And people might say it's fear mongering when it's like, oh, well, if they do this, like it's the, if you give a mouse a cookie analogy, if they do this, then they'll do this, and they'll do this. But it's really not an analogy anymore, guys. Like they had said in 2016, vote us in, because of the Supreme Court justices, right? So whether or not the Trump campaign wants to take, well, he does, he takes ownership of the fact that Roe v. Wade was overturned. He just doesn't take ownership of the impended consequences of overturning Roe v. Wade, which is kind of, again, an oxymoron. You can't say, I'm so proud that I put in place these 3 Supreme Court justices that royally dismantled your rights and made it so that women are dying in this country because they can't access reproductive health care. And I don't agree with that, but those were your actions, right? So again, if we are going to be a leader, I'm a boss. I am the leader of my household and I am the leader of an organization. As the leader of that organization, I cannot make new policies and then throw my hands in the air when those policies are crap and they don't work and they're negatively affecting my clients and just say to everyone like, well, you guys said it would be good and just like leave it the way. Like that's not acceptable. You are a leader. You need to be implementing those plans. You need to think through how these things are going to work all the way through. All the way through. You know, we can't have concepts of a plan. I'm sorry. That's not a thing that we can do. We can't have concepts of a plan. And again, for those of you who are like, well, it probably won't happen. And if it does, it won't be that bad and we can fight it and there's other protections. So I don't need to worry about it. Like they are slowly dismantling our rights. They're slowly chipping away at us. And this is how it happens in history, guys. It's not that authoritarianism or any of these countries where people's rights are severely being violated, that this happens overnight. They are slowly chipped away at. It is a slow process that chips away at our reality, right? And it gets easier. Like these little things just keep happening and we adapt and then something else happens and we adapt and we just keep moving along because we all feel powerless, but we are not powerless. We are not powerless. We all have voices. So I know this has been a lot to take in. There are a lot of rights on the line and what they want to do is honestly very disturbing. I want to provide you guys some more information on specifically the Comstock Act, which I did discuss earlier in this episode, but I want to go into specifically how that affects us and what they're looking to do with that law, because there are multiple cases pending right now that will probably eventually be kicked up to the Supreme Court, in which the Comstock Act could be used to prevent materials from being shipped between state lines, which would essentially be an abortion ban nationwide. Because if you cannot get the materials you need to perform the care, and it's illegal to transport them, that effectively means that even in states that want this, they cannot do it. So getting into this, if you haven't heard of the Comstock Act, guys, it's by design. It's an old law, like really old. dating back to 1873. It was originally put in place to criminalize the distribution of obscene materials, which at that time included anything related to birth control and abortion. Fast forward to today, and this outdated law is being dusted off and used in ways that directly impact our reproductive rights. And let me tell you, girls, it's not just a historical artifact, it's a live wire. The Comstock Act is being revived in court battles over abortion pills, contraception, and even information related to reproductive health care. As a professional working mother, I know you've got a lot on your plate, just like I do. Juggling a career, kids, and life in general, it might feel like this law is a distant issue, and all of the stuff I've discussed today is distant, but it's not. The truth is the Comstock Act has the potential to restrict access to healthcare that many women rely on, including birth control and abortion services. This will change everything from us, from the care that we receive to the information we're able to access. Okay. So again, the Comstock Act, by the way, basically criminalizes mailing and transportation of certain materials, including contraception, information on contraceptions, and items used to produce an abortion. So they're trying to use this as a nationwide abortion ban by limiting access to medication, medical supplies that would be needed for us to have an abortion. And obviously, abortion is not just about, elective abortions. We're talking about, what we would need in the case of something happens to your baby and you're miscarrying. If you have an ectopic pregnancy, there's literally a woman who just died recently in September 2024 because she had ectopic pregnancy and they would perform an abortion on her, which was needed. So the fetus kept growing and her fallopian tube blew up and she died. This is very real for me. So what can we do, guys? So the first step is staying informed. So thanks for listening. If you watched all the way through, at least you now have some information exactly like you're doing right now by tuning in. But knowledge isn't enough. So I want you guys to have some steps you can take. I want you to contact your representatives and let them know how you feel about reproductive rights. You are their constituents and your voice matters. We want to support organizations fighting for reproductive rights, like groups like Planned Parenthood, the ACLU, and others are on the front lines battling these issues. And we want to have the conversation with our partners, our friends, our family. My husband will be voting the election for the first time ever, and I've always been super political, but especially with us just having a daughter, even he, who's like the most apolitical man in the world, is like, yeah, okay, we got to protect our children, our family, and the future generations to come, because this is truly that important. And then these conversations need to be a part of our daily lives if we want to create change. And then the final thing, when we're writing those legislators, I want you guys to talk about the Equal Rights Amendment. So if you haven't heard about this one, it's designed to guarantee equal rights for all American citizens, regardless of sex. And back earlier in the episode, I was outlining for you guys how they would like to redefine sex and gender and sex traits, so they're not protected. So unless this is codified into our Constitution as an additional amendment, our rights are on the line as long as crazy people can get into office and dismantle them. So it's pretty straightforward. But here we are in 2024 and it's still not fully ratified. So this is huge because without it, there's no clear constitutional protections against sex-based discrimination. The Equal Rights Amendment, ERA, could be a critical tool in protecting reproductive rights by ensuring that laws like the Comstock Act can't be used to disproportionately impact women. So what's next, guys? I want to leave you with this thought. The fight for equality and reproductive rights is ongoing, but you're not powerless. Whether it's educating yourself, getting involved in activism, or just making sure you vote in every election, your actions can make a difference. I'll be sharing links in the show notes to resources where you can learn more about the Comstock Act, the ERA, Project 2025, as well as a link for a petition that was generated by Hunter College, which is my alma mater. Shout out to Hunter College, CUNY Hunter over in New York City. We are very big on the oppressive lens there. So it's not really shocking to me as an alum that they have a petition going. But I'm going to drop that in the show notes as well. There is a petition that you can already written for those of you that are like, I don't have time to write. Great. Jump on this website, go sign it, sign your name. It'll send it to your congressman or woman. And it can help seriously to get this Equal Rights Amendment added to our Constitution so that protection of us on the basis of our gender, our sex, is not able to be discriminated against, which seems pretty basic, but clearly the powers that be don't feel that that should be a thing. Okay. And as always, let's keep the conversation going, guys. If you have questions or thoughts or anything that resonated with you today that you want to hear more about, or other things that are going on that are like, Jamie, how are you not talking about this? Please shoot me an email, write a comment, send us a message. Any way that you can. We are on YouTube, TikTok, Facebook, LinkedIn, like all social media. We're pretty much streamed. So you can look up Good Enough with a Trauma Therapist, Jamie Vollmoeller, find me, reach out. I would love to hear from you guys and to be providing information on things that, light you up and that you're passionate about, because that's what we're doing. We're building community and we're stronger together, guys. I want to remind everyone that you are good enough.
Thank you for listening to Good Enough with the Trauma Therapist. We appreciate you listening. While our host may provide some personal and professional advice, we want to remind you that this show is for entertainment purposes only. Each individual situation is unique, and Good Enough is not a substitute for mental health treatment. If you need a therapist and are located in New York or Missouri, feel free to reach out to us at liendr.com or resilient-mo.com.